Hello and welcome everybody. Today we're going to talk about peripheral IV catheters and the color coding system. Unfortunately, on your anesthesia rotation, you're not always going to be able to place every peripheral IV, but it's important to know what the gauge is. So how do we tell? Well, luckily there's this kind of standardized system to be able to tell the gauge based on the color of the catheter. And so if we look at the color code here, our IV catheters are going to range in anywhere in size from a 14 gauge being the largest to a 26 gauge being a really small catheter. So I like to kind of think of this as a journey to the center of the earth. So if we go out to space, there's not much there. That's going to be our finest needle, the 26 gauge. As we go down, we see this yellow sun hanging up in the sky. That's going to be our yellow 24 gauge. The sky is blue. That's going to be our 22 gauge. So 22 gauge peripheral IV catheters are going to be blue. Down below the sky, we've got this pretty pink flower here. That's going to be our 20 gauge or kind of standard gauge needle for many adult patients. 18 gauge, we're getting a little larger here. That's going to be our green grass. And our large bore IVs, the 16 gauge is going to be gray, kind of like rock or soil. And then eventually, when we go down to the center of the earth, we have the magma there at the core. If we look at Poissier's law here, we can see that the gauge is going to directly affect the flow of the peripheral IV catheter. So we see our radius here, which is going to relate to our gauge. The length can also change between different brands and sizes of peripheral IV catheters, and that's going to have a negative effect on our flow. And so if we look, our 14 gauge is going to be the largest. It's going to flow 240 mLs. It's going to be great along with the 16 gauge for traumas, for surgeries where we need large volume fluid resuscitation. Our 20 is going to be our common adult size, able to put a lot of volume down, and then our pediatric sizes are going to be a lot smaller. Thank you for listening.